Good afternoon, everyone. My name is Josh Allen. We're reporting Vanguard Health Systems 2013 investor presentation. I'm joined by Sean Kofoid, Laura Blake, and Kristen Kofoid. And our financial information is current as of June 20th, 2013, and the year-end fiscal year is June 30th, 2013. Just a brief overview on the company. We are a Fortune 500 company operating regional healthcare delivery networks. We have 28 hospitals and related outpatient facilities, and we are also a managed care plan provider. We are based in Nashville, Tennessee, but we are incorporated in Wilmington, Delaware, and I just wanted to let you know where we operate here. We have 6 hospitals in Phoenix, Arizona, operating 1,029 licensed beds. Texas, Brownsville, and San Antonio, we have 7 hospitals with 2,540 beds. We also operate 7 imaging centers in Texas. Chicago, we have 4 hospitals with 1,138 beds. Detroit, 8 hospitals, 1,734 beds. And Massachusetts, we have 3 hospitals with 640 licensed beds. Our managed care plans are beginning to grow as part of our growth of our business. Phoenix Healthcare Plans, a Medicaid managed care plan in Arizona. The Abrazo Advantage Health Plan is managed Medicare dual eligible plan serving about 3,400 members in Arizona. Chicago Health Systems is a preferred provider networks serving approximately 32,600 members in the Metro Chicago area. And Valley Baptist Insurance Company, VBIC in Texas, has approximately 10,300 members. Just a brief overview on our governance, and you can find all of this information on the investor relations section of our website. We try to maintain a highly independent board. 7 of 8 of our directors are outsiders and own significant shares of our stock, so they are personally vested in the company. We maintain strict guidelines to maintain that director independence, and we also have a lot of rules on interlocking of directors and succession planning. We also have a strong management team with over 20 years of experience in the industry that own over 12% of the business. So they're also very committed to the financial success of the company and have your interests in the best mind. Vanguard's mission, very simple: to help people achieve health for life. Central to this mission is a significant focus on clinical quality, where we have implemented several initiatives to maintain and enhance our delivery and quality of care. We've also invested in clinical best practices, patient safety initiatives, and we've also made significant investments in IT, as illustrated by our transition to ICD-10 and our EMR programs. Our vision is to create lifelong relationships by changing the way healthcare is delivered in our communities. And that's kind of illustrated by our transition from fee-for-service to fee-for-value. And this is something that we've taken an early step on by implementing some of our accountable care organizations. We have 2 currently going on right now. Our Michigan Pioneer ACO program, the Medicare Pioneer ACO program. It's one of the first 32 in the country that was allowed to start under Medicare. Had a great deal of success with it so far. And we've also just partnered with Dignity Health for an ACO in Phoenix with 700 physicians, and that is going well so far, in addition to the Michigan Pioneer program. One key part of our strategy is acquisitions. We've acquired over 13 hospitals and their related healthcare facilities in the past 2 years, and we continue to monitor our industry in order to try to find hospitals or systems that strategically fit our vision and long-term strategies. Some of the competitive advantages that we enjoy are a leading position in many of our markets. Our markets have favorable demographics, large size, good payer mix, and we feel good opportunities for growth. We have a broad network presence. We have capital investments that have helped establish a positive reputation in our patients and our referral sources, and we believe we have the ability to attract leading physicians and other healthcare professionals in our industry. We're now going to transition to the external environment that we face as a company and some of the pressures on our industry as a whole.
Real quick, if you want to just reference the handout that you were given today, it goes over our board of directors, our management team, and then also some key takeaways about our company. So clearly, the healthcare industry is changing. That is not a secret, and ACA is going to bring significant change industry-wide. Price pressure increasing across all facets of healthcare, which is not only going to mean a company has to show positive health results, but they also have to be as efficient as possible in the care that they deliver. The transition from fee-for-service to fee-for-value is going to offer a time to shine for those who have been preparing, and Vanguard is one of those companies. The healthcare winners must modify their business to stay lucrative. So, for example, new infrastructures have to be created, they have to be implemented into your company, including a standardized revenue cycle approach, increasing your information systems infrastructure, leveraging your best practices, and tightly controlling your supply chain management. The external environment in healthcare, basically competitors of Vanguard, include the competition for Medicare and how all of the Medicare expansion is going to play out in the industry. So we may not have significant benefits immediately, but different negotiations are continuing, and we believe that the results will be positive. Healthcare exchanges, we're positioned to gain share in 2014 from exchange products based on the early exchange negotiations and the narrow networks. And also, the integrated health systems are going to be new winners in the healthcare marketplace, and Vanguard is already at forefront in that in those implementations. We operate successfully in a lower price environment. We've proven that time and time again, and we believe that all of our systems that we've implemented over time are going to be models that other companies are going to be following. And now we're going to be discussing financials and our current environment.
So go over a few different financial pieces of information. We'll start off by looking at the Q3 results, which are the most current results that we have access to today. Compare those to prior year Q3. Then we'll go look over the results from financial year to date compared to the prior period. And then talk about some outlook of where we think things are going to head here in the future. So key results, we're looking at everything for Q3 of 2012. There was an important one-time bit of revenue that we received. It was attributable to reimbursement updates for the roll forward revision of the Balanced Budget Act of '97, and also revised supplemental security income ratios. Because that put an extra about $50 million in revenue, want to make sure that we adjust all those numbers back out. So everything that we're going to compare over here, you can see is adjusted to reflect removing that information from the comparison so we can make a valid comparison from period to period. So if you look over here, we've got net income for this last quarter was $21.3 million. Compare that to $21.7 million in the prior period. EBITDA grew just a little bit as well from $142 million to $143 million in the current period. Looking over the year-to-date results, we see really some strong growth here between prior year when we had $38 million in net income. We've grown that to $47.4 million over the last year. Comparing again the EBITDA numbers, this number over here is all of these are inclusive of that one-time additional money, the $50 million in revenue. So the EBITDA here is a little bit reduced in the current year compared to the prior. But remember, this didn't have that one-time value back from 2012. Moving ahead to the outlook for Vanguard, we have a good growth that we were expecting to see moving from 2012 into 2013. You can see that last year we had a net income of $57 million. And that we're projecting is going to grow to somewhere between $59 and $65 million for this year. Probably a good time to point out that all of the statements I'm about to make are forward-looking. They reflect management's best judgment what we expect to happen, but obviously are neither a guarantee, and that it's entirely possible that the actual results could differ materially from what we're presenting here. So again, looking at the potential for between 3 and 14% of growth in net income, and then EBITDA, we're projecting between about 6 and 8% growth between last year, where we had $520 million in EBITDA, to this year we're projecting somewhere in the $550 to $560 million. I want to also look at EBITDA growth over time. This has been really one of the success stories here. You can see we started off with less than $200 million in EBITDA back in 2010. And between 2010 and 2012, we have experienced 38% compound annual growth rate moving from those years. Obviously, we're expecting to see a bit slower growth in this current year, but the current growth rate we're estimating is about 7%. It still compares very favorably to our competitors. You take a look at Tenet as another company that has a relatively high growth rate there at 5.3% compound annual growth. HCA was at 3.5%. And CHS at only 1.5%. Again, that's what our competitors have been doing between 2010 and 2012, same period where we had about 38% compound annual growth, and we're projecting, again, about a 7% growth rate in 2013 once everything comes in. I'm going to pass the presentation over to Kristen, who will finish us off.
Thank you, Sean. So as my colleagues have demonstrated, we're a strong company with a position that's very well suited and poised for the industry and a really good financial outlook. So how are we going to take this and grow this even further? Well, looking forward, there are 4 main areas that we're looking forward to actually continuing that growth and continuing that good financial outlook. The first is to maximize operational efficiencies. We're also going to assess population needs and adjust payer contracts. We're going to look at securing physician alignment and growing market share, and then investing in population health initiatives. So for the next few minutes, I'm going to go over each one of these in a little detail for you to lay out for you exactly what kind of strategy we're looking to implement going forward. So first, looking at maximizing operational efficiencies, there are actually 2 different areas that we're looking at to accomplish this. The first is in our same-store growth, and then also in new markets. So for same-store growth, we're continuing to be sensitive to the need to lower the cost of healthcare, and that's going to improve our delivery systems by really focusing on those core measures of clinical quality and high reliability and the patient experience of care. So we're really focused on getting those scores in the right place so that we can have those good low costs. And as consumers continue to become more and more price sensitive, that's going to be more critical to our growth path forward. We've also instituted a lean management to identify efficiencies and opportunities to improve quality, safety, and experience in our markets. So we're really looking to also take those lean management opportunities and implement them further. Some of our early adopters of those lean management strategies have seen improvement, considerable improvement actually in the results, and we've got a lot of optimism about how that can impact our future acute care operations. So then looking forward, we're actually also going to refine some of our service line strategies. We're adopting evidence-based standards of care in clinical areas such as critical care, emergency medicine, hospitalist medicine, and radiology. So the adoption of these standards is going to also improve our quality and increase our operational performance and reduce our clinical variability. The other thing that we're really doing in the same-store area is implementing a customer relationship management system, and that software package also includes a physician relationship management tool. Now, what this really is going to do for us is it's going to help us understand how to see the marketplace and how it influences and affects our care delivery. And then once we have that good, strong understanding, we're going to be able to tactically implement and measure strategies that will positively impact the behavior of consumers and physicians. This application actually supports initiatives around population health management, readmission reduction, care transmission, chronic care, and disease management programs. So there are a lot of really good places that this software touches, so we see that as a really good opportunity for us. Also looking into new markets, we're going to actively seek to acquire new facilities. So with reform on the radar, There's much price pressure and requirements for greater capabilities and capital needed to actually succeed in the industry. So we see this as an excellent opportunity for us to continue in our mergers and acquisition strategy. So for example, we're actually looking at 2 opportunities in Connecticut currently. We've got letters of intent in that state with 2 different opportunities. Also, it's important to note that we've got a really good track record as an acquirer. We are considered best in class as a partner with non-for-profits. So we believe this gives us a really unique advantage to continue in acquiring some good facilities. And we look forward to using our robust pipeline as a path to grow more in this area. The other thing we're really looking to do in new markets is really that strategic partnership to build out integrated networks. And Josh actually mentioned this earlier. An example of this is that partnership with Dignity Health out of San Francisco. That's a non-for-profit group that we've partnered with. And that group is helping us form an accountable care organization in Arizona. And it also is helping us form a clinically integrated network there so that we can increase the number of doctors who will participate in that ACO. So looking at assessing population needs, there are 2 different areas that we're actually going to be doing that as well. So first, I want to talk just for a minute about our health insurance plans, and then look at new opportunities in current markets. So for the health insurance plans, our general business strategy has really been to go into large urban markets, and therefore a disproportionate number of the individuals that we serve in those markets are actually uninsured. And that's where more of these individuals congregate, that's where more of them live. And so we really believe that we stand to benefit a lot with Medicaid expansion because we serve a significant portion of those uninsured that are currently being treated as self-pay and charity care. With Medicaid expansion, they'll now have coverage and we'll be able to see some payment from those treatments. So we really feel that this is a strong area, especially in Arizona and Michigan. So there's a really good opportunity for growth there for us. Also, we're trying to proactively prepare for the health insurance market. It goes open enrollment, coming this fall, and then goes online at the beginning of next year. So it's a little bit unclear at the moment how we can participate in enrolling patients. But what we are doing is we're proactively analyzing our patient data, and we're stratifying patients into different eligibility categories based on the financial data that we do have on them. So if they do come back to us post enactment of the exchange, then we'll actually have that financial history to help us segment them into the appropriate area for the exchanges. We also believe that we're positioned really well to gain share in 2014 from exchange products based on early exchange negotiations and neural networks that we have. Especially in Texas and Arizona, we feel that we're particularly well positioned for this. And early returns are actually showing that the reimbursement we'll get from that is slightly below commercial, but actually above Medicare. So we feel really, really good about that. Also, we've got some new opportunities in current markets that we're really looking to do. So we're hoping to actually realize the benefit of the current market synergies that we have now. As Josh mentioned, we've actually acquired 13 hospitals in the last 3 years, and we really get to realize the synergies associated with acquiring those facilities. And so we're hoping that that will really start to come to fruition now as we've raised that operational performance to the same level exhibited by some of our most successful hospitals that we have in our existing portfolio. We also are really going to continue to invest quite a bit of money in capital improvements. We're really looking especially to build actually some new facilities, new inpatient ambulatory facilities, and develop those out, and that's just going to help extend our network in those areas that we're currently in. So just as an example for you, this is just a really good timeline of all of our major capital projects. As you'll see, we've got some new facilities being added on here, and then we've got some improvements to existing facilities that we're really looking to expand. So we're actually on track with our plan to invest approximately $500 million in capital expenditures this year. And then as you see, moving on into 2014 and 2015, we're going to continue with that trend in hopes of really building out these networks and making them more profitable. So also, we're looking at physician alignment and population health initiatives. So population health is really something that you're starting to hear more and more and more about as healthcare reform starts to take effect. and especially with the Affordable Care Act coming in and being implemented. And we have really just seen this as a necessary investment in our future. And we really have been very proactive in looking forward and going ahead and positioning ourselves well to be able to have that fee for value model adopted in our facilities. So as we continue to work hard at improving our hospital services, we're going to focus on and make investments in our ambulatory risk and population health platforms, because we believe those things are positioning us to benefit from kind of changes. And we believe that we've actually probably invested a little more heavily in some of these areas than some of our competitors have. So we feel like that makes us a really strong investment moving forward. So then also we are looking at accountable care organization participation. Josh mentioned that we have several products out there that we're working with CMS on, and our early indication is that these are going to give us some positive results. And we're actually then looking to learn from some of those pilot projects and aid in the implementation of ACOs as we move forward. The other thing that we're really doing with physician alignment is we're really focusing on primary care redesign. Our urban markets especially, we really want to find a model that's adaptable to the populations that those markets serve, and we're really looking to refine our processes to adjust that primary care model to make sure that it really is tight and that it's giving us and feeding us the value that we need moving forward into acute care for those patients that need it. Our participation in those 5 CMS accountable care organizations, alongside over 2,200 physicians, continues to go well. We actually have approximately 77,000 attributed lives and an approximate annual healthcare spend of $1 billion there. And we really feel that those investments continue to position Vanguard for success in the move towards value-based reimbursement. So just as a summary for you, we have this experienced and aligned management team, and we're really dedicated, as I said before, about making sure that our health system does transform into that fee-for-value model, and we're dedicated to executing strategies that position us well for that time. We have proven ability to successfully complete and integrate acquisitions, and we look forward to doing that more so as we continue down the path to growth. We have an established track record in managing risk and bundled payment, and we've been a partner with CMS for a long time in looking at some of these bundled payment models and experimenting and trying new things that have shown us some good success. We have an opportunity to continue cost reduction and margin improvement, and this is really going to come into effect when we see some of those market synergies coming together, as I mentioned before. Then finally, we have this established integrated network, and we continue to expand in our population health activities in a way that's meaningful to our patients. It's good for them, it's good for us, and we believe that it's the best way to execute on business and healthcare today. So I really appreciate your time. Thank you very much for watching, and we look forward to your comments.